All right, then we can get started. Thank you everyone for adding your names in the chat box. So welcome again to the second session of Join the Conversation, Culturally Responsive, Evidence-Based, and Community-Defined Practices for Mental Health, a listening series led by the MHTTC Cultural Responsiveness Working Group. I'm Aria Costa. I'm the Behavioral Health Equity Specialist for the South-Southwest MHTTC, which is Region 6. And I'll be sharing some logistics information during this session. With me, there's a great team who are also part of the working group. We have Isabeles and Daris Ortega from the National Hispanic and Latino MHTTC, and Jessica Gonzalez from the Coordination Office. You'll see and hear them during the presentation or on the chat box. We have also great panelists and Gabriel Orsi as well, helping us with this session today. Let's go to the next slide. Just as always, let's do some housekeeping items, important information for us to keep in mind. We have made every attempt to make today's presentation secure. So if we need to end the presentation unexpectedly, we will follow up using your registration information. So keep in mind if something happens, check your email. All attendees are muted and cannot share video. If you have a question for the presenters, remember to use the Q&A pod. Our co-chair is managing the pod and will address questions throughout the session. If you have any audio or tech issue, please use the chat box. We'll be looking at it all the time. You will receive an email following the presentation on how to access a certificate of attendance. Closed captioning is available, so you can use it anytime you want. And remember to follow us on social media, Twitter, Facebook, at MHTTC Network, and of course, our website. Please note the session recording will be posted on your website within a week. Let's go to the next slide. For today's session, we will be using Poll Everywhere, which is a great platform that allows us to have participation with our audience. We'll be asking questions and we would love for you to participate. You can use it through your web browser or your phone. When the first poll comes up, we'll explain how to use it, so don't worry about it. Just make sure that we'll be using this platform during the session. Next slide. So the MHTTC network accelerates the adoption and implementation of mental health-related evidence-based practices across the nation, develops and disseminates resources, provides free local and regional training and technical assistance, heightens the awareness, knowledge, and skills of the mental health workforce. And we have 10 regional centers, a National American Indian and Alaska Native Center, a National Hispanic and Latino Center, and a network coordinating office. If we go to the next slide, we can see our map. You can see all the different regions highlighted in different colors. After today's session, we suggest you to visit our website and find your regional center to keep in touch with us for more resources and training opportunities. Let's go to the next slide. There's a super quick disclaimer reminding us that this presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Use Abuse and Mental Health Services Administration, or as known as SAMHSA, and the opinions expressed here are the views of the moderator and panelists and do not reflect the official position of SAMHSA or DHHS. Let's go to the next one. We want to remind you that at the end of the session, we will have an evaluation, and just ask you to please, at the end, we'll have a reminder of this. Let's go to the next slide. All right, so let's get started. For this session, we're going to be talking and sharing about Familia Adelante. Let's go to the next one very quickly. Thank you. And a quick reminder, of course, that the HTTC network uses affirming, respectful, and recovery-oriented language in all the activities. To the next one. And this is brief information about what the working group is. The Cultural Responsiveness Working Group aims to disseminate culturally appropriate information and provide technical assistance for the mental health field to improve access to culturally responsive mental health services. Recognizing the importance of EBPs and the work across MHTTC network, this group began exploring how to adapt the principles of these EBPs for diverse and underserved communities. Through this work, Our group discovered the importance of also acknowledging and promoting additional culturally inclusive mental health practices that exist in the mental health field. Therefore, our group is conducting the 6-part series of 90 minutes listening sessions, which we have on the next slide, the objectives of the listening sessions, which are engaging constituents in an interactive conversations about EBPs, explore strengths and barriers of community-defined practices and elevate them as culturally and linguistically appropriate services standards, and of course, identify ways to increase promotion of these EBPs and community-defined practices in technical assistance and trainings offered by the MHTTC network. Go to the next one. This is our overall agenda. As we see, we're going to do an overview of Familia Adelante. We're going to do several polls, a Q&A piece, and a wrap-up. Now to welcome our panelists, we have my colleague Isa Velez from the National Hispanic and Latino MHTTC.
Thank you very much, Ari. And we welcome our panelists for today's presentation. We have Dr. Richard Cervantes, is a research director of Behavioral Assessment Inc. Also, Dr. Cervantes was the principal investigator of the NIH-funded study, Development of the Hispanic Stress Inventory 2, and PI on the recently completed study, Familia Adelante, a multi-risk prevention program for Hispanic youth. We are so happy and glad to have you here today. And also we have Adriana Avila Di Bello. She joined the AAMMA family in 2006 with over 25 years working in the HIV and communicable diseases field. Also, she has current oversight of the Minorities Action Program, MAP, and is committed to prevention, education, and maintaining a productive climate. So thank you very much for your time and your disposition to be here today and to present and talk about Familia Adelante. I think this is going to be an amazing presentation that would help all of our providers. So we are gonna get ready and start with our poll to see who we have in our audience. Thank you. So you can download the app or you can just go to the link. They will be shared in our chat box. You can text NWMHTTC to the number 22333. So they are gonna put it on the chat box. If you have any problem, let us know on the question box. So I'm gonna give you a minute to answer our first poll. It looks great. I think now we can start with Dr. Cervantes, and as we can see, almost all of the participants are not familiar with Familia Adelante. Dr. Richard Cervantes, you are on mute.
Thank you, Ari and Isa and all of the MHTTC network family. Muchas gracias y buenas tardes a todos. It's a pleasure to be here. And again, on behalf of SAMHSA and the MHTTC network, thank you for inviting, and the Cultural Responsiveness Work Group, of course. Thank you all for having us today on this panel. I will introduce my colleague, Adriana Di Bello, who's also Familia Adelante trainer and actually is implementing the program in the Houston, Texas area. So she has a lot of information to share with us today. And as we can see from the poll, yes, not many of you are familiar. Familia Adelante is a relatively new evidence-based practice. We continue to do research and studies on the program. And I'll be talking a little bit more about how we're getting the word out about Familia Adelante and some of the trainings that we have already conducted for SAMHSA. So if we can go to the next slide. And moving forward. So today, really quick, we want to take the first 25 minutes or so and just kind of give everyone an introduction to what Familia Adelante is. First, to meet the developer, myself, and some of the trainers. And we want you to have a basic understanding of what our program is, which is basically a mental health promotion and early intervention program for Latino youth and parents and their families. Not necessarily parents, but their caregivers. We're going to provide a summary of real quick of some of the research and practice related to Familia Adelante, some of the practice related issues. We're going to consider any barriers, challenges, or other issues that you may have in your community in terms of adopting and sustaining Familia Adelante. Again, as the mission of the MHTTC is to get to promote and actually get out into the community some of these practices. We want to make sure that we answer any of your questions about how you can implement the program in your communities. And so with that, let's move to the next slide. So some of the trainers here, and this is an abbreviated list, but folks that have trained with me, including Adriana, who's one of our trainers, and again, is implementing the program in Houston, Texas. Ricardo Torres, out of North Carolina, Cindy Marroquin in Colorado. Mr. Fred Sandoval is one of our master trainers, and he's also actually the director for one of the TTCs. Nasli Restrepo, clinical social worker here in Orange County, California. Melissa Gomez is in Arizona, and David Salinas also here in Los Angeles. So we have a representative East Coast, West Coast, and Texas set of trainers. So we're well represented. Let's go to the next slide. So let's get into the real quick overview of what is Familia Adelante. It is a risk prevention and early intervention program. It's a family-based program model, and it consists of 12 English or Spanish language 90-minute modules for what we call at-risk youth, Latino youth ages 10 to 14, and their parents or caregivers. And I highlight here that it's English in English and Spanish. We are working with Latinos directly. The program was built or created by and for Latinos. So in this way, we want to make sure that you all know that we're very aware of the class standards and that the program really touches on most all of the class standard criteria. The second bullet is very important. We recruit youth that have shown early signs and symptoms of behavioral or emotional problems, very similar to what you might find in the DSM adjustment disorder, like a mixed disturbance of emotion and conduct. Although it's not a requirement that our kids that are recruited into the program, it's not a requirement that they have a DSM diagnosis. That's very important for everyone to understand, is we actually want to get kids before they get into the formal mental health treatment system. The next bullet shows us that Familia Adelante is an evidence-supported and culturally specific behavioral health practice as designated by SAMHSA and their National Network for the Elimination of Disparities. We have actually trained at actually over 25, now it's up to about 40 implementation sites that have been trained through the support of SAMHSA. And those sites are located all across the country. We just finished a SAMHSA training for 5 organizations, including organizations in New Jersey, South Carolina, Connecticut, Washington State, and in Texas. So we continue to work with SAMHSA to train as many organizations as we can so that they can actually implement our program. We have a very intensive training and technical assistance program so that if you decide to use Familia Adelante, we provide you with a fairly intensive training, certification, and follow-up coaching to ensure that the program is in fact implemented and sustained in your community. Let's go to the next slide. So some of the guiding principles of Familia Adelante, as I mentioned, it is a early intervention program for kids 10 to 14. These kids are typically referred into our program by school counselors, by teachers, by other youth workers, and by parents, right, that that have noticed that their children are acting out, they're having emotional or behavioral disturbance. And so once the children and the parents agree to participate, then the groups are led by trained promotores or other behavioral health providers. So we train promotoras, promotores, or other social workers, psychologists, but to know that we're capable of training and feel very confident that promotoras can run our intervention. Familia Adelante offers a safe space for youth and families to share stressful life experiences, sensitive cultural issues, and problems in a group setting. Familia Adelante helps youth and parents normalize their experiences of acculturation and family stress through facilitator queries, action-oriented activities, and role playing. And this, so every session that we have, which typically occurs once a week for an hour and a half, we're using a variety of clinical and counseling skills to help families learn more about their own experiences. Uh, the second to the last bullet, which is really important, Familia Adelante helps youth and families develop healthy coping skills through mutual group problem solving. And cultural resilience is very much emphasized, and we want to help families relearn some of the strengths, recursos culturales that many of our families have lost. Familia Adelante emphasizes strengthening of cultural identity through affirmation of our cultural values, beliefs, and customs. So it's the program is very much steeped in la cultura, in cultural issues, and we're really helping families navigate the acculturation process. Let's go to the next slide. We have a short video that I want to share with you for one of the sites that has implemented our program, and we thought this might be informative for you. It's a couple-minute video. So if we can start that, please.
So this program arrived at Saban as an idea from one of our new community liaisons. Her name is Glory. She came up to me one day and said, "You have to hear about this program."
Familia Adelante is a 12-week curriculum that focuses on targeting the cultural barriers, the risk factors, and the stressors that affect every day the youth and the families of the school.
At Saban, we have a large Latino population, but we had minimal voice from those parents and students. So our hope was through this program, we would empower those parents, those students, they would have a larger say and a larger voice in the Saban community.
Immigrants are afraid to express their need There's fear, there's that language barrier as well, that they feel like they can't communicate effectively with the school and with their kids as well. So we felt that Familia Adelante would be the perfect program to incorporate with the school.
So we don't have that Latino parent group formed in our school yet that can inform some of our school decision making. So I'd say that was the primary goal. Second goal was that the students and the families would learn skills through this evidence-based program and apply those skills. I mean, we hope to see increased grades for our students, increased communications among family systems, decreased behavioral incidents for students as well.
We meet with students and their families once a week. We talk about gang prevention, we talk about substance abuse prevention, we talk about peer pressure and stress in the family, such as acculturation stress that some families face when they're moving from a different country, their home country, to a new country. They have to start kind of figuring out the new culture, the new language, and so that causes stress within the family.
Two benefits that I have just seen personally. Number one is the connectivity that we've seen among our Latino families and the amount that we're seeing families come in. They're coming in because they now know Glory, our community liaison, so they're coming into school to advocate for their children's needs. So we've maintained that number of anywhere from 18 to 22 families for all 10 to 12 weeks.
So Servicios de la Raza is also a very good navigator of resources. So we are able, with our resources at Servicios de la Raza, connect families, introducing some of the partners that we have been partnering throughout the sessions. So we'll have Big Vista. We're also going to announce some of the programs that Servicios de la Raza has available. We do have the diabetes prevention program.
I got to sit in on one of the sessions that was working on family dynamics and communications, and it was just a powerful moment. So the parents sat and planned with their facilitator. The students sat and planned with their facilitator, and they were covering 3 topics. They were covering, I'm frustrated with, was the prompt, I appreciate about you, and then please forgive me for. And then they brought the groups together and facilitated that conversation and did it in a way that was really effective. It was a high emotion night. This was some of the first times for these families that they opened up with each other and were able to express some true feelings, both from the student and parent perspective. I thought that was a huge bonding moment and a powerful experience.
Well, thank you very much. And as you can see, this was a program that a site where we trained a large organization called Servicios de la Raza, located in Texas. And this organization was very successful at recruiting a lot of immigrant families and pulling them in for the 12-week program. And as you can see, was very much a success there in the Colorado Springs School District. So this was actually vetted and operated out of the Colorado Springs School. Let's go to the next slide. As they say, sometimes a picture is better than 1,000 words. So we thought that video might be helpful. Just a couple other comments about some of the factors or stress factors that we address in Familia Adelante, including acculturation gaps, cultural and educational stress, immigration stress, community and gang-related factors, discrimination stress, family and drug-related stress, family immigration stress, and family economic stress. So all of these things we know from previous research, which helps our program actually be steeped in evidence, so research-based. We know that each and every one of these factors, as kids have high levels of these stress, they also tend to have they're at much greater risk for mental health problems, depression, anxiety, and delinquency. Next slide. Similarly, when we work with the parents or caregivers, these are some of the cultural factors and topics that also have been related in our research to be connected to mental health problems. Family and cultural conflict, discrimination stress, health-related stress, economic, immigration, pre-migration stress, which we're all becoming much more aware of these days, that it's not just the stress that our families have come when they're once they arrived in the United States, but it's that whole migration experience that can create a lot of trauma and stress. Parental stress and marital stress and cultural differences. So we weave all of these things into our sessions. And let's go to the next slide. In addition, our promotoras really encourage and utilize what we call our cultural resilience and protective factors. We're really very much in tune with bringing back values of familismo, improving communication, uh, reestablishing respeto in these families, and some of the other things that you see that are presented here, especially on the bottom here, encouraging resilience and strengthening cultural identity and traditions. These are all part of the 12 lessons and 12 sessions that we try to promote as part of Familia Adelante. Next slide. Sample just real quickly of some of the sessions. We have an introductory session where we typically collect consent folks if they haven't been consented already and collect evaluation data. Session 2, we're talking about some of the basic concepts around prevention, resilience, stress. Session 3, we're exploring feelings and how those affect our behaviors. Session 4, we're giving kids an overview of stress, what it is and how it affects us. Session 5, we get right into acculturation stress and how that affects families. Next slide. Session 6, school-related stress. 7, peer pressure. 8, family stress. 9, we're talking about gangs, as that is an issue especially in many of our urban areas. 10 is focused on substance abuse education. And finally, week 11 is our family night, where we bring the parents and the kids back together, and we have some very powerful sharing exercises that really culminate the program. And then week 12 is simply another post-test evaluation session, celebration, and we typically give the kids out a graduation, or the families a graduation certificate. Next slide. We've added recently some online Familia Adelante modules, so it's now available online. It's an 8-session program. That was because of COVID, actually. Many folks were kind of in the middle of implementing and needed something, so we actually developed, in association with Adriana's group in Texas, in Houston, we created the online Familia Adelante. We've also added sections on marijuana and opioid prevention. We've created youth and the parent curricula, and we have a new youth workbook. So all of these things are part of our training and part of the materials that are available for implementation. Let's go to the next slide. I'm not going to go through a lot of the researchy stuff here, but next slide. This was one of the publications that came out where we shown that for families and youth that participated, we found reductions in past 30-day drug use, increased perceptions about drugs and the perceptions of harm around drug use. We found reduced conduct problems, reduced learning problems, reduced hyperactivity, reduced anxiety, and increased parent knowledge about substances and HIV. So these were published results. Next slide. And the next slide, please. There's an independent evaluation that's been ongoing out of the Arizona Governor's Office. And just to summarize this, that for the 161 families that have been followed so far, they've shown improved family cohesion, improved attitudes towards drug use, improved knowledge of the risks and harms of alcohol and substance use, improved parent-child communication, and importantly, increased parental involvement in the children's activities. So these are also published results. Next slide. This is just a shot of one of our recent groups that was conducted here in Orange County, California. This was a family night. So this was the night where parents and kids came back together all in one session. I know I'm going quickly, but we want to make sure that you have just kind of get a flavor for the program and what it is encompasses. And I'm going to go to the next slide and turn it over to my colega and co-trainer Adriana Di Bello. Adriana, I want to talk a little bit about your experiences with Familia and there in Houston.
Absolutely. So AMA, which stands for the Association for Advancement of Mexican Americans here in Houston, Texas, we received a SAMHSA grant, and it's a SPIF grant in 2019. This really allowed our organization to implement the Familia Adelante curriculum over the next 5 years. And so Dr. Cervantes was able to fly to Houston and facilitate this face-to-face training to 10 of our employees and 3 additional individuals from other agencies. We began the implementation phase when, like, right along the time the rest of the world and we were all facing that COVID pandemic, and so quickly we had to think of some different strategies here to implement, and we got with Dr. Cervantes as well as some other trained facilitators, as Dr. Cervantes had mentioned before. He has practically the country covered, right? And so we switched this intervention over to that virtual implementation, creating the Spanish-English version. And I will honestly say that working with Dr. Cervantes has provided, that continued ongoing support through the challenges and barriers, of recruitment, implementation, evaluation. He's just not only there just throwing out this implementation or this curriculum, if you would. I mean, he's really in it, he's there to provide you that support through those challenges. And he's, there to also share the successes of your organization. And I've been in this field for about 16 years. I've never, not once have the experience working side by side with the developer or a developer that has demonstrated that true commitment and dedication in ensuring that trained facilitators and organizations have all the support to really carry out a successful implementation of the intervention. As far as our continued recruitment, at first it was, very difficult. I would say that, you had COVID in place, so there was a lot of, individuals that had to be quarantined. They couldn't come out. Families were faced with just so many different stressors. And to be quite honest, once we started getting enrollments and referrals, families felt so good about coming. They wanted to continue. They wanted to keep coming back. And I think that nobody was prepared for COVID. So I think everybody went through stressors. And so even being allowed that safe space to share, those family issues that were going on, where you had to deal with, I remember, one kid, he was like, I just can't take being stuck at home with my mom all day, and so, being able to share that and get that out, being able to talk about, the losses, that was a huge thing for kids. They didn't know how to deal with those issues. And so, being able to really give them that safe space, I think has been the most impactful for these families, and then coming back together, and being able to get through it and have a good time and move forward. We have done a couple of sessions where, it's dual. It's some were face to face, some were virtual. So we've had to do a lot of flexibility with our community.
Great, thank you, Adriana. I really appreciate your input. And Adriana, as I said, has also become one of our trainers and helped us with the recent training for the SAMHSA NetLearn. So thank you very much, Adriana. I really appreciate it. And our goal here really with Familia Adelante is we know that the program model works. It's just a matter of getting it out to familias. It's not an easy program to implement. I mean, there are some moving pieces and getting, I think the most important thing from an implementation standpoint is getting organizations on board, right? And making sure that organizationally there's support for implementing a new program model. Many of you are probably working in, in within the context of being funded by either state or local or county, city government. And sometimes they have a list of their programs that, that they'll fund. And so, you know, organizations will gravitate towards those programs that they know they're going to get reimbursed for. So there's some issues around financing and sustainability that we try to help you with at the local level. But again, our mission is to get the program out to the kids because there are a lot of kids out there that are hurting right now, a lot of kids, Latino kids that fall through the cracks, that only end up in, either in the mental health or juvenile justice system that could have been prevented had we intervened early. So our goal is to identify those kids early on, help your organizations identify those kids and get them into our program. Once they're into the program, they typically really like the program. Parents and adults love the program model. They're excited to come back. We've actually had one school district in Florida where they wanted the program done every day. So it's quite a popular program once it gets out into the community. I know we have only a couple of minutes left on our end. I think we have another poll coming up. Yes, Ari? Did we have another poll coming up? Let's go to the next slide. I mean, there's one last slide. Oh, I'm sorry. Uh, in terms of the training, how could I forget? So what if your organization decides to get trained, and the more the merrier, right? So more people to get trained, the better off you're going to be in terms of covering the groups. But you'll receive 16 hours of training, intensive training. You'll learn about the program, how it was developed, some of the background studies. You'll there'll be a lot of hands-on learning using the youth and parent manuals, a lot of role playing on Familia Adelante, the implementation. There'll be an opportunity to develop your organization specific recruitment and implementation plan. You'll learn how to use evaluation as a tool for monitoring your successes. And you'll become part of our Familia Adelante learning community to share challenges, barriers, and successes through a series of 4 post-training TA webinars or coaching calls. And then individuals that complete the program training will receive a certification as an official Familia Adelante facilitator. So that's our training. And next slide. So you can learn much more about the program itself, about our training, either contacting myself and you can see the website there or the email address, or contacting our coordinator, Donna Camacaro, at that phone number, 310-652-6449, or you can visit our website at familiaadelante.com. So with that, I'm going to turn it back over. Thank you all for your attention. I really appreciate you joining in today and learning a little bit about our program. I'm going to turn it back over to the MHTTC staff.
Thank you very much, Dr. Cervantes, and also thank you, Adriana. This information I think is so valuable for our providers. So we're gonna go to our next poll question. We can go to the next slide. Also, you can send a text message. You can send a text to NWMHTTC to the number 22333. And also they will share the information on the chat box. So I think that's a little bit more easy for everyone. And the question is, what interests you have about this particular practice the most?
And while people are chiming in here, also there are several questions in the Q&A and several uh, inquiries in the chat box. So I know we will get to all of them. We may not get to all of them this afternoon, but uh, I'm sure that we'll be able to provide you some written responses as well. So I see what interests you about the practice most: family-oriented, solution-focused, yes, culturally appropriate. The cultural sensitivity is another comment. The generational aspect of planning and centering on family, right, as a source of support. Absolutely, that's what we do promote. Um, we've known for a long time that you really, because of the strong cultural values towards familismo, if we can do a family-oriented program, it works much better for our Latino communities. Here's another one that says they liked the methodology, the evaluation. Yes. And we have more to, so there was a comment in the question and answers about sharing some of the research studies, and we'd be happy to make those available through the MHTTC and give you all the PDFs of what we have. And more here, parent involvement, culturally relevant. Yes, here's an interesting comment. The program for teens who are always confused about their in-between cultures. I would like to do something like this program, but I'm in private practice. Um, it's possible that you take a look at the research papers and you might glean something from that. Or when we share this we share this PowerPoint with you, you saw the sample listing of the lesson plans. You might be able to use some of that to kind of at least work with your individual clients on. Okay.
Thank you everyone for your participation and answering the poll questions. I think we have another question. Also, you're gonna text, and our question is, how likely are you to be able to use Familia Adelante in your work if you got more training on a scale of 0 to 5? 0 means not likely and 5 very likely.
Okay, and the magic of instant polling, we're seeing a lot of responses coming in here in the moderately likely to very likely. We're getting a lot of people that would very much be able to use the program if they got more training. Thank you for your responses. So for MHTTC, yes, it looks like our audience would benefit much more from continued training on the program, and there's certainly an interest here.
Yeah, that looks amazing. So the majority of the participants answer very likely. I think we have another poll question.
Yes.
And here, please share any perspective to consider if you were to use Familia Adelante. So feel free to write, to share any perspective that you have.
Okay, so we can see some answers coming in here. any perspectives you consider if you were able to use Familia? So keeping families involved. Another person likes the fact that it includes families. Uh, there's a question here about attrition rates. The attrition rates, at least in some of our studies, are they're not high. The completion rates are over 70%, closer to 80% over the 12-week period. And one of the things we like to do if a family or a youth misses a session is to offer a makeup session that can be done either individually, or if you have more than one or two kids that, more than a couple kids that missed, you can pull them all together as a group. But we do like to encourage at the agency level that you offer those makeup sessions. We do also have a fidelity monitoring tool that kind of tracks kids' participation, and also it's a way to help sort of keep program staff on track in terms of the actual curriculum materials and making sure that they cover all the activities that are in each of the sessions. Here's some other comments that they liked, that the program was prevention in nature, youth intervention, helping raise awareness in the school district. Yes, that's very important. Um, budget, existing barriers of structural issues in my organization. That's what I was mentioning. We have to figure out a way to get buy-in organizationally, and we have some techniques and things that we like to offer for organizations at that level as well. We also encourage, if you're going to get trained in Familia Adelante, that you have somebody at that administrative or decision-making sort of level that participates in the training. Here's another one that says parents are always at a loss with their teen behavior since they do not understand the cultural elements. I like to educate parents about the cultural differences, but a program that is designated for both children and youth would be in a better proposition. Yes. So that's part of what we do, is we help parents understand from a developmental perspective what their kids are going through during that acculturation process, how it's affecting the kids emotionally, and vice versa. We try to help sensitize the kids to the fact that their parents were raised in a certain way and that they're going through a transition as well. So these are all very nice comments and very much informative in terms of helping us think through how we can help organizations implement and adopt a program. Here's another one that really likes the focus on promotoras and enhancing family communication skills. Yes. Very well. Thank you.
Thank you, everyone.
Great,
we have one.
great comments.
Great comments. We have another poll questions, is our third question. And it says, can you envision Familia Adelante being funded or sustained in your community?
And Adriana, maybe while we're getting those poll questions, beyond your SAMHSA grant, what are your plans for sustaining the program?
So, of course, right now our agency does have 2 charter schools here in Houston. And so part of that is also looking at our, I guess, charter schools budget, right, to implementing that. The other would be to, there's always the need for intervention such as this with Child Protective Services, and some of even the juvenile justice court systems, right? And so being able to do, that type of relationship, independent school districts, we get calls from all over the Houston and surrounding counties, asking for us to deliver certain types of services. And we've been approached specifically on certain topics that relate to this particular intervention. And so being able to approach the districts, you know, with some type of proposal, you know, sometimes they have after school funds, there's you know, I would even say like certain schools do fundraising and other things that can probably fund either a prevention specialist or a community health worker. Um, the other thing is that you can also look at it at a perspective of, you know, you're educating families on HIV related topics. And so this, you can look at, you know, talking to funders, you know, state funding sources, or looking at that avenue, maybe even the city or counties that you might work under. So there's funds under Ryan White. Of course, SAMHSA sometimes puts out grants, and there's also private donations, you know, at times. So there's other funding streams that you could potentially look into.
Thank you, Adriana. I very much appreciate it. And we're seeing a lot of polling questions here, which is the, you know, where the rubber meets the road. It's always about funding and yes, it's an interesting question. There are a lot of you saying yes. You think that you could get the communities to buy in, and um, I think everybody that's chiming in here is saying there's definitely a need. I've seen a couple that say, unfortunately, there wouldn't be a way to fund the program in their communities. So it would be interesting to see why not. Um, I'm guessing it's because of organizational and structural barriers. But um, these are interesting comments. And again, these comments will really help us think through our strategies and particularly, you know, during our training, how we can help address some of these issues for communities. These are the kinds of questions that come up during the trainings around sustainability.
Thank you very much, Adriana and Dr. Cervantes. And now we're gonna pass to the next slide. We're gonna talk briefly about community-defined practices. And there are practices that communities have used and found to yield positive results. We can go to the next slide. Also, community-defined evidence provide positive results as determined by community consensus over time. Also, these practices may or may not have been measured empirically, have reached a level of acceptance by the community. Also, a population's worldview and historical, like take into consideration, right? A population's worldview and historical and social context, and consider and complement to evidence-based practices. Also, we're gonna go to, we're almost finished for today. We have another poll question. If you can also participate on this one, this is our last one. Feel free to do it. And the question is, what challenges or barriers do you foresee in the implementation of Familia Adelante in your work?
And while we're waiting for those responses, let me again just remind people, if there is an interest in learning more about our program, to go to the website or reach out to the MHTTC staff, and they would be happy to work with you and make our connection with you. I'm seeing some polling responses coming in. Keeping constant awareness of activities. Again, these are barriers or challenges that you foresee. Engaging appropriate partnering for funding, yes. Here's a group that says we have a small population. Here's one, implementation overload. Not sure what that means, other than this person is being inundated with a lot of new programs to implement, perhaps. Management, approval, political red tape. The novelty of the process. I'm guessing that means the newness of Familia Adelante. Let me just remind everybody that Familia Adelante is being used in several SAMHSA grants. So if you decide you want to propose the program as part of a grant, at least at SAMHSA, they know about our program and have vetted it. And so it's certainly possible to include the program as part of a proposal. Here's a couple of barriers around physical space, finding bilingual trainers to deliver, being able to talk with management and having it approved, yes. Funding, administrative decision-making, yes. Again, these are the kinds of things we see in organizations that come to our trainings. I like working with groups, but the challenge would be to find a partner to present the program. I really do not see budget being so much of a problem here. If I could find a partner, I would like to promote and do the program. Interesting. Living in a primary white city, I've done trauma-informed with youth, but when it comes to Latinos population, there's little or nothing being done. Yeah, that's problematic. So, so thank you guys. These are, again, these are the kinds of comments that help us as we do our work and as we think about our training and how to work with organizations across the field to learn more about, vetting the program within your organization, within your community, and then as well as getting resources for funding and sustaining the program.
Again, thank you very much, Dr. Cervantes. And now we are going to Q&A to our panelists. So feel free to ask any question on the question box or in the chat.
So we've had a couple of questions that came up in the question box. One was about the evaluation and how we do the evaluation, and whether another question was whether or not some of the studies were available. So I'll talk a little bit on that. Yes, we do have a couple of published studies that we would be happy to share with you, and I can make those available to the MHTTC staff, and they can distribute to those that were on the webinar today. As far as evaluation, there are a number of different ways to evaluate the program. We've tried all kinds of different variations in doing evaluation. Right now, for example, with our virtual Familia Adelante sessions, we're using a QR code method of, so when it's more of a client satisfaction evaluation. So when the kids finish the 10 to 12, the 8 sessions with the virtual, then they get a QR code and they're able to sort of do it's about a 15 question satisfaction tool. For more intensive evaluations, we've done pre, post, and follow-up assessments using a different sets of behavioral measures, family communication measures, stress measures, including measures like the Hispanic Stress Inventory. So there are many ways to think about evaluation for the program. Here's another question. The identity issue is included: personal, group, old immigrant, new immigrant. The program really is developed in a way that we think that it can be applied to both US-born Latinos as well as immigrant groups. In one of our recent data analyses, we found that actually the program helps reduce cultural stress if it's more effective in that area for immigrants, not necessarily new or old, but immigrants compared to US-born Latinos. So we do know that, but the program is developed in a way that the questions and the way that the material is presented, that very much appropriate for immigrants, both new and older immigrants.
Yeah. Dr. Cervantes, we have my co-worker here, Dr. Daris Orbit, and she will be also providing some of the questions for you.
Okay.
Thank
Thank
you.
you. Thank you, Isa. And thank you to our presenters. For those of you who don't know me, I'm Daris Sorovision. I'm the TA and training content consultant for the National Hispanic and Latino Mental Health TTC. So Dr. Cervantes, you've been already answering our questions, the ones that have been coming up. So we have another question that I'm going to share with you. This participant is saying, I'm a new employee at my organization and can see they need help developing a program like this, but I don't know how the administrative response will be. How do you recommend I approach them to implement real change?
Adriana, you want to respond to that? You've been dealing with that issue organizationally.
So with I actually come from an investigative background, right? So I was a disease intervention specialist, and you know, I provided a lot of support to nonprofits, and I was a liaison at the time. So I think part of it is also really talking about and making it distinguish behind your community needs. So if you're able to really identify the needs of the community and then you know, present this intervention as something that it's going to help the community get better. And then what is it in the long run? How does it fit in to the organization? You know, their mission, their goals, you know, all of those, you know, what's their vision? And so really looking at how it aligns with community, the organization, and, you know, program services or the delivery. They're more than likely, you know, the questions will come up like, you know, well, how do you expect us to pay out of this? Or what's the, you know, how are we going to be able to sustain this? And so those are all these questions that are going to pop up when you're approaching upper management. And it could be, you know, a lot of times it's the coordination of between task forces or coalitions. So you're partnering up with other people, not doing it alone. You know, when you start doing things in silos, things never get done or they're not completed. So really looking at, you know, how it's going to be carried out, and so putting together that plan.
The other thing I would say for this question, um, you know, if you can help your organization see that there's an opportunity for providing more services to a different group of people with programs like Familia Adelante or other evidence-based or community-defined programs. So in other words, they need to understand what the need is out there in the community. Um, and I recommend that you look at some of the recent SAMHSA data on children and youth. I know there was another report that I just saw. I think it was the Pew Research Center looking at CDC data for 2020, and it absolutely shows that, for example, suicide and depression, suicidality or suicidal ideation and depression in Hispanic youth ages 12 to 17 has doubled since 2019. So, I mean, those are the kind of statistics that sometimes administrators pay attention to. So you have to demonstrate that there's a need in your community, and you have to be an advocate and a champion for that in your community and know the data, know what the needs are. And as Adriana said, developing partnerships with other community organizations or other community advocates can be a really good thing.
Great. Thank you both for your answers. We have another participant asking, what is an estimate of cost for startup?
Um, I can tell you about the training, and then maybe Adriana can talk about staffing and startup issues. Um, for training, in our pricing for the training is listed on the website. I think it's fairly reasonable. If you can get a group of people, as Adriana did, she had like 12 or more people that got trained, 15 people at one time. So that's how you can reduce the cost of that. But the costs are minimal. They're pretty much in line with other, actually, they're probably even much less than some of the more popular evidence-based practice staff trainings. But Adriana, do you want to talk about the actual, the cost of implementing the program?
Sure. So I think Gilbert, yeah, of course you have to take under consideration the training cost. You are going to look at, what type of, who's actually going to be implementing the project. So, as far as, is it going to be a prevention specialist, a community health worker, your promotoras? And so those are really important to consider because their salaries are different. Who is going to be doing your evaluation and your the monitoring, the fidelity. Is it a program manager or a project coordinator? you know um, and then you have also the expense. Are you doing it virtually or is it in person? If it is virtually, you want to plan on getting something that is HIPAA compliance. Zoom has HIPAA compliance features now, and I think their cost is something like a maybe 7 to 9 or 10 individuals signed on at a cost for like $1,000 or roughly. The other things that you have to take under consideration is that, well, you're spending less money if you're not using a place, right? You're doing it virtual, but if you're doing it at an actual location, is this an in-kind donation? Are you able to, actually go and do the sessions at a facility that they're not going to charge you anything for, or are they going to charge you? So most of the times they won't charge you. You're doing it at no cost, right? And we provide light snacks for families. So like I would on an average budget, maybe about $3 per person, roughly. You can come a long way with, especially if it's a large group. And then there's a lot of times it's the donations that we get. So we work very closely with the Houston Food Bank, and they're able to provide different items for the families. Um, I can't think of like much more other than your typical your other cost, and it just depends on your organization how large it is. If there's any administrative cost that entail to the programs.
Let me add to that. I mean, just to break it down even further on the implementation. So you really, if you have, we typically like to see about 10 youth, 8 to 10 youth, and 8 to 10 parents in one group. So if you think about those groups, let's say you're doing a group, after school group every week, right, with 8 to 10 kids, 8 to 10 parents. Um, you're going to need two facilitators, right, to do the planning and preparing for that session. Then you're going to need the same two people to run the session. And then if you want any evaluation or data collection done, or any other post meeting time. So, you can figure two people, minimum of like a full day to run one group session per week. And then the same for the parents. If you're having the parent sessions done at the same exact time, you're going to need two additional staff people. So, we recommend that at a minimum, you have 4 staff people, right? Part-time, you're not full-time people, but part-time running Familia Adelante. Again, it's an hour and a half, but then there's prep time, there's, case management time afterwards in case an individual family needs special one-on-one time with you, that sort of thing. I also highly recommend, if you do train promotoras to do the program, that you also have a licensed clinical person as a backup, right? It's because you're always going to find that one family or more who either at the beginning or during the middle of the program, something's going to happen with that family and they're going to need a clinical intervention, right? Like an intensive one-on-one. The child might, God forbid, become suicidal, or the parents might separate, or there may be other issues that cause a big family crisis, and it's going to require an assessment and a clinical intervention. So you got to have at least a backup licensed person, there to kind of help oversee these families. So hopefully, Gilbert, that gives you a sense for costs.
Thank you both again for your responses. There's a question here regarding the curriculum and if it will work with non-immigrant families, third and fourth generation families. And there was a previous question regarding adaptability to Black communities. So I'm thinking that our participants want to know about the flexibility of the curriculum.
Okay. Let me speak to that because we're working with a group in, they're a SAMHSA grantee, and they're actually working with Native American and Latino, third and later generation Hispanic families. And so they went through a process of making some, what I call surface level adaptations to some of the language that's used in the curriculum, but they found that the emphasis on culture in general is highly applicable and relevant for even non-immigrant kids and Native American kids. Now, of course, we're evaluating the effectiveness of that right now with the Native American youth, but they were able to make those adaptations. In our original study, not all of the kids were immigrant in the published study, and we report out on the effectiveness of working with non-immigrant youth as well. We know the program, again, because of the way that the open-ended nature, the discussion, the free discussion that it evolves during the process of the groups, you can have an immigrant youth in the same room with a third generation Latino Mexican American kid, for example, and it still allows them the opportunity to have their voice, to make their concerns known, and to have some of the other kids help in that problem solving process. So they don't need to be like all immigrant groups or all non-immigrant groups. And as I said, we are now in the process of making adaptations for Native American families. We have not worked to make adaptations for African American families. I think it would be fascinating to do that because of some of the cultural issues. I think it would be doable, but would take some planning to make those adaptations.
I think that is having trouble with her connection, with her internet. Sorry for that.
Any other questions that you all might have, please feel free to put them in the Q&A box.
Mhm.
So, Dr. Cervantes, it looks like there was a question there. It says, how would this curriculum work with non-immigrant families, third and fourth generation familias?
Right, and I think I kind of touched on that. I don't know,
Okay.
Adriana, if you want to mention that, because I know you got a lot of Chicano, Hispanic families that you're working with?
We do, yeah. I was just thinking about one particular family. So this really a third and fourth generation family combined, and um, I would say that we have been able to continue, you know, with the lessons. Um, it's really important, I think, that because it's in a group and you have a combination of individuals and the backgrounds, and so when you get to talking, you know, you see the parents really reflecting on what the other parents are really sharing or talking about, and then they kind of come in and really start thinking, well, why, how important, you know, the continuation of some cultures and the things that are were being done. And you know, one family got away from sitting together at the table for dinner, and that was something that they had traditionally done, you know, them growing up. And as her new family came together, that wasn't something no longer being done. And so she recognized the loss, right? That loss of opportunity. And so I think that there was opportunities there for them to kind of engage with each other. And so that was really helpful. It also allowed individuals who are non-immigrants versus the immigrant families to really talk about, you know, trauma, what they lived through, what their experiences are. And it's kind of like an eye opener for those, because they don't see it that way. And then they recognize, well, maybe some of the things that are going on, and how they can really teach their kids about facing fears and you know the other stressors that may come into place. And so it really is, it becomes a little bit more of a support for one another as it continues.
Thank you, Adriana.
Thanks. Did we touch on also the identity issues?
Um, well, identity in Familia Adelante, we strongly encourage and support and try to reinforce our cultural identities, regardless of what those might be. And that's why I say for the Native American kids, that's really important. Um, African American kids would be extremely important as well. But we encourage, and as part of, we have several activities where we are engaging kids about who they are, what their ethnicity is, um, um, what, you know, helping us learn about what some of their cultural practices are, practices of their families. And so we we try to make those front and center as part of our lessons. Obviously, when we're talking about things like acculturation stress, right? And we're talking about identity conflicts between parents and kids. Um, those come up a lot, both in the parent sessions and the youth session. What we what we promote and what we encourage and what we value are the cultural identities and cultural the way culture is formed in our kids, because oftentimes that is kids are either discriminated against because of their cultural identity, or they're called bad names, or they're bullied on social media. And so we have to, as you know, as healing adults, help them have a safe place to talk about that and to let them know that it's okay and it's encouraged for them to have a strong sense of cultural identity and a strong sense of ethnic and cultural belongingness. So those are things that we definitely promote as part of our program.
There's another question here. It says, have you run into challenges with LGBTQ plus youth and acceptance from their families? How do you address these challenges? You know, with this particular implementation, we have not had that run in. I will say that in a previous intervention that we were conducting, we have, and with that particular intervention, we were also conducting that intervention actually at the school. So it says Aria Costa. Oh, okay. I'm just kind of going through the questions there.
Come
So
back just in case.
great. And so I can't really tell you right now, but I do, again, you know, as Dr. Cervantes mentioned earlier, you know, having a clinical personnel on staff is really important. If not, having also the collaboration established, you know, to where you can be able to have somebody come in and support that family through those um, you know, through that time frame, that, you know, trying to figure things out as a family. And it, for the most part, I've never really experienced anything absolutely negative. You know, it's just kind of getting through the hoops, if you would, and more about educating families as a whole, and being able to give the family an opportunity to learn how to communicate with each other, because it's sometimes, a lot of times, it's the communication. Kids don't know how to talk to the parents, parents don't know how to talk to the kids, you know, and so it goes from there. I think the next question asks, how do you address or active spiritually as a forgotten asset?
No, we talk about that in some of the family related sessions and in the acculturation stress session. We very much encourage, and in fact, you know, some of our newer research is showing how important spirituality is in terms of being a protective factor or as a resilience factor in a lot of the families, in a lot of the Latino families. So we very much encourage that discussion. As you know, Catholicism is very powerful in many of our communities, and so to the extent that the church or a strong sense of spirituality serves to help families cope and to have hope, then we very much want to encourage that.